All right, good evening, everyone. I'm Dr. Michael Twyman, the biohacking cardiologist. I'm a board certified specialist in heart attack and stroke prevention. Tonight, we're going to be talking about sleep apnea, what it is, how to screen for it, and what are some of the options for treatment. So last week I had done a talk about sleep optimization 101 or sleep hygiene, how to improve your environment so that you get more optimal sleep. So if you haven't seen that one, it's up on my YouTube channel, also on my Instagram TV feed, about 30-minute chat about how to optimize your room, how dark it should be, how cold it should be, how to wear blue blocking glasses, timing your meals, time of exercise, and some other good biohacks on how to optimize sleep. So tonight I'm going to talk about sleep apnea. So what is sleep apnea? So sleep apnea is when you stop breathing while you're sleeping. So there are different screening tests that you can do. There is a questionnaire that I usually recommend patients take called Stop Bang, STOPBANG. Go to that website, stopbang.ca, and it has the quiz. I'll just run through the questions tonight, and then we'll kind of go through some of the other features of sleep apnea. So, it is an acronym. So the S is snoring. So do you snore loudly enough to be heard through a door, or does somebody have to wake you up because you're snoring so loudly? Are you tired during the day, fatigued? Don't feel like you got a good, well-rested sleep episode? Have you been observed to stop breathing by a significant other, or you're choking on your breath overnight? Are you being treated for, hypertension or high blood pressure? Is your body mass index greater than 35? So not a great metric for body composition, but it just gives you a rough estimate. Are you more at risk of having sleep apnea? Because people who are overweight or obese are more likely to have sleep apnea. Are you older than age 50? And then neck size. So is your shirt collar greater than 16 inches or 40 centimeters? And are you male? So you answer these questions. If you get a score of 0 to 2, you're low risk. If you get a score to 3 to 4, you're intermediate risk. If you score 5 to 8, you're high risk. So most likely the intermediate and high risk people should go ahead and go get screened for sleep apnea. So, 24% of men may have mild, moderate, or severe apnea. So 1 in 4 men. Up to 9% of women, so approximately 1 in 10 women have sleep apnea. And the unfortunate fact is that 82% of men and up to 92% of women with moderate to severe apnea have not been diagnosed yet. It's extremely underdiagnosed. It usually takes many years before somebody actually goes, first tells the doctor about it, 2, gets set up for a sleep study, 3, actually starts getting treated for it. So apnea is just cessation of breath. I think clinically you have to be greater than 10 seconds to count as an episode of apnea. Some people will stop breathing for up to 30 to 60 seconds during one of these spells. When your airway closes off, you're not oxygenating your cells. That puts a significant amount of stress on your body. Inflammation ensues, and you basically start aging faster than you should. There's some reports that people probably die approximately 20 years earlier than they should have if they leave apnea untreated. So again, what are the signs? You wake up in the morning, don't feel like you slept well, can't concentrate, you're fatigued throughout the day. Those are signs that you potentially do have apnea. There are certain conditions that are more associated with apnea, high blood pressure being one of the major ones, coronary artery disease, congestive heart failure, strokes, acid reflux. Those are some of the major ones. Thank you everybody for joining tonight. We got a few people still coming in on my other feed as well. This is being recorded, so if you missed the intro, no worries. We're just going through the basics of what sleep apnea is and then how to get tested for it and then potentially some treatment options. So we already went through some of the ways to test, called the Stop Bang quiz. Gives you some ideas if you're more at risk for it. But we'll go into how do you actually screen for it. So apnea episodes, 5 to 15 episodes in an hour would be mild. 15 to 30 is moderate apnea, and greater than 30 episodes in an hour would be severe. So once every 2 minutes, you're stopping breathing for 10 seconds or more. You could also have hypoxia episodes where your oxygen saturations are dropping I think there's some different cutoffs, but typically probably less than 88% is probably a good kind of cutoff to say that you're truly having a significant hypoxia event. So there is a difference between obstructive and central sleep apnea. We're not going to talk too much about central sleep apnea tonight, but central sleep apnea is approximately 1% of the population. Basically, the brain doesn't tell the breathing muscles to work appropriately, and you stop breathing because something's going on in the brain. That's more associated with people who have congestive heart failure, weak hearts. That message, for some reason, the neurohormones don't make the brain work as well as it should. And then also people who've had previous strokes have more risk of having central sleep apnea. So the device that I'm going to talk about tonight does not necessarily screen for that. For those ones, if you've had strokes, congestive heart failure, you may want to actually have an in-lab study or polysomnography. So you actually go to a sleep study center and sleep there, and they hook you up to a bunch of different wires and monitors, and then they can tell the difference between central and obstructive apnea. But obstructive sleep apnea, that's the lion's share. So that's the one we're going to focus mostly on tonight. Again, for those who are just joining, thank you. 1 in 4 men have mild, moderate, severe apnea, 1 in 9 women, and it's underdiagnosed. Maybe 80% of people who have apnea have not been tested for it yet. You can take the quiz, the stop bang quiz, to figure out if you're more high risk to have apnea, and if so, you should go get at least talk to your doctor. If I'm your doctor, I'll talk to you about it. And then if you're a good candidate for it, they may be able to set you up with a home sleep study. And so anybody who's on Instagram tonight, I reposted my feed from earlier in the year when I did a home sleep study. I used the WatchPat device from Itamar. It's a disposable device that syncs up to your phone. You sleep in your own bed. It looks like a watch. There's a little wire, a little finger probe, kind of like a pulse ox, and then a wire that sits on your chest that watches if your chest is rising. And then in the morning time, it syncs up to your phone, sends it up to the cloud, and then a board-certified sleep medicine physician reviews the data and then comes up with a diagnosis: normal, mild sleep apnea, moderate sleep apnea, severe sleep apnea. The device was, fairly easy to use and was, painless for sure. So home sleep studies are valid for, obstructive sleep apnea for sure, but it's going to miss restless leg, narcolepsy, central sleep apnea. This is not what a home device is for. It's to really pick up obstructive sleep apnea. So if you're snoring loudly, witness apnea spells, more likely have obstructive sleep apnea. So these devices can work for that. Some insurance companies now almost sort of force you to do a home sleep study. In the past, it used to be the opposite. Everybody had to go do the in-lab study. You're getting equivalent data for the most part to diagnose obstructive sleep apnea. Now, what to do about the data? If you're more on the mild side, I usually tell patients 1 to 2 things. You can talk to your dentist about making a mandibular device, basically a special mouth guard that pulls your jaw open, and the air can then get past the obstructed airway. Or depending on what your anatomy is, you may benefit more from positive pressure, either a CPAP or a BiPAP, where the air is blowing in and keeping the airway open. If you're more moderate severe, that's going to be, for the most part, going to be positive pressure, so your CPAP or BiPAP. The mandibular devices might work a little bit, but they're probably not strong enough to keep the airway fully open overnight. Those are kind of the quote treatment options. From a lifestyle standpoint, well, if you're drinking excessive alcohol always makes people snore and have more apnea episodes, so no alcohol or cut it out. Some data shows that smoking may have an effect on apnea spells, so potentially that might be another reason to quit smoking if you're still smoking. Weight loss definitely can have an effect. If you have a very large neck, like I said, over a size 16 collar, you're more at risk. You lose weight, the airway may not collapse as much. And then there's some people that have different anatomical issues with their sinuses or their posterior pharynx. That might be more amenable to a ear, nose, throat doctor, ENT doctor, looking in there and maybe shaving off some of the tissue, and then that keeps the airway open. So it sometimes is a kind of comprehensive, team that takes care of people with sleep apnea. So, first you have a loved one or somebody who, notices, hey, you're stopping breathing when you're sleeping. Why don't you go get checked out? You talk to your primary care doctor, or if I'm one of your doctors, I will ask about how your sleep quality is and if you've been tested for sleep apnea before. then going to get a sleep study. Some cardiology offices, mine included, do home sleep studies. If you are positive, then I refer you on to a sleep lab that can then get you set up with whatever treatment, if it's going to be a mandibular device or positive pressure. Some insurances, like I said, won't necessarily cover a home sleep study, so you do have to go to a sleep lab, and then you want to actually look for a board-certified sleep specialist to give you the actual results. So those are the kind of the basics of what sleep apnea is, how to screen for it with the stop bang questionnaire. What can you do to get tested for it? There's in-lab studies or at home. At Apollo Cardiology, we do offer the we offer the at home with the watch pad. And then, if it's abnormal, mandibular devices that, some of the dentists can make, or positive pressure. So I thank you guys for your attention tonight, and I'll open up to any kind of sleep-related questions. And again, for those that joined a few minutes in, I did start right on time because I usually am pretty punctual. This is recorded. This will be on the Instagram TV when we're done chatting tonight, and it'll be up on my YouTube channel by tomorrow. Question, better to sleep upright or how? That's a good point I didn't mention, is some people only snore when they're lying flat on their backs. If you can, learn to be more of a side sleeper, you will likely snore less. There is a device that I think one of my patients called it the parachute, but some other people have done it, with the t-shirt, get a tennis ball, and so a pocket on the back of the shirt, and then put the tennis ball in there. And then if you roll over on your back, you notice that, oh, okay, I'm sitting on my back, and you roll back over to your side. How many hours of deep sleep should you have in a night? Typically, it should be about 20% of your total sleep time. So somewhere between an hour, hour and a half of a deep sleep would be good. And then again, another hour, hour and a half of REM sleep. And last week I talked a little bit about the Oura Ring. That's still my kind of preferred sleep tracker. I'm going to be playing with another device pretty soon and see kind of head-to-head if there's any significant difference between them. The devices are pretty good about tracking your time in bed and probably your sleep duration, but how well they differentiate between deep sleep, REM sleep, and kind of the lighter stages of non-REM sleep, it's not totally accurate as compared to a in-lab sleep study, but it kind of gives you general directions. And you can compare yourself to yourself. It's pretty accurate for yourself, but trying to compare to your friend or somebody else, like, hey, I got 23% deep sleep last night. That's excellent, right? Well, unless yours is always around 23%, it may not be comparable to that person. And for people who have sleep apnea that's not treated, they're never going to go fully through those 90-minute sleep stages where you have light, deep, REM sleep, and then back up. They're going to keep waking themselves up into these light cycles and then kind of keep going back down. So for the most part, people who have sleep apnea are not going to necessarily have vivid dreams because they're never getting fully through those sleep cycles until they get the sleep apnea treated. So how long should it take you to fall asleep? That's the sleep latency is the term for that. Typically, it's, I'm pretty fortunate and probably unfair. I mean, I can put my head on the pillow and fall asleep in a couple minutes, but you should be able to fall asleep probably within 5 to 10 minutes of going to bed. I heard it in the book Why We Sleep, which is still probably the best book on sleep. It's by Dr. Matthew Walker. You should only go to bed when you're tired and ready to sleep. It shouldn't be a place where you're going to read a book, watch TV, and be associated with staying awake. His analogy is you would not go to the dinner table and just sit there until you got hungry, and then that's when you would eat. You go to the dinner table when you're hungry. And so the converse is that if you get into bed and you're still awake 20 minutes later, You probably should get out of bed and go do something calming for a while until you're tired, and then try again. It's probably better to continually have the same wake up time and get a compressed night of sleep. So you're not in bed for 8 hours. If you're just rolling around for 2 hours, get up, go read on a non-backlit device if possible, or just meditate or do something that's not very stimulating. And when you're tired, go back to bed. But get up no matter what, even if you're quote tired at your normal wake up time at 5, then that helps you build the sleep pressure for the following night to go to sleep. If you kind of start phase shifting your wake up times and bedtimes, your body doesn't necessarily get confused, but your circadian rhythms aren't as optimized, and your sleep quality is not going to get back on track as fast. Question about breathing exercises helping. They can. I personally don't do many of them because I don't have trouble sleeping, but you can do a box breath, which I help tell people for help relieving stress. So you want to probably do your breathing exercises before going to bed, but if you do wake up in the middle of the night and can do the breathing exercises, you might be able to fall back asleep sooner. So a box breath, typically breathe in for 4 or 5 seconds, hold it for 4 or 5 seconds, breathe out for 4 or 5 seconds, hold for 4 or 5 seconds, and then repeat, and do that cycle 4 to 5 times. Usually that's one I would say more with your awake and before you go to bed, but I think a 4-7-8 way is probably better while you're laying in bed. So breathe in for 4, hold for 7, blow out for 8, and repeat those a couple times. Question, somebody says they unfortunately suffered a heart attack and then developed sleep apnea. They're 45. I have a real hard time falling asleep with the CPAP mask. So it's probably a combination of chicken and the egg. It's likely that your heart attack was more precipitated by sleep apnea. Sleep apnea takes many years sometimes for people to get diagnosed. And while you're having these episodes where your body's getting hypoxic, that puts tremendous stress on the heart. Because as the airway is closed, your body is transmitting all that pressure to the heart. Then the airway has to pop open, and then that pressure gets released on the outside of the heart. That causes significant inflammation, and all those inflammatory markers are going through the system. The arteries are getting scratched up with that inflammation. So it's mostly inflammation from the apnea and even the hypoxia that can drive the atherosclerotic process. If you're having trouble with the CPAP mask, the best thing to do is talk to the sleep center. There's different masks that you may have to go back in and do a fitting. There's some that are nasal pillows that just fit in your nares. Some just fits right over your nose. There's sometimes the one that looks like a scuba mask where it's like your whole face is in this thing. So there's just different masks. And yes, sometimes it is, a trial and error type of process. And ultimately, sometimes people can't absolutely tolerate CPAP. So if you're more on the mild case, then that might be an instance where you talk to your dentist and see can they make a mandibular device. And so while we're waiting for other questions to come in, reminder, last week I did sleep optimization 101 or sleep hygiene 101. So I always wanted to have your hygiene dialed in first, blocking artificial light at night, wearing blue blocking glasses. If you're hardcore, have the red lights on instead of the bright lights at night. Cool room, dark room, quiet room, place where you're going to sleep. It's not a place to do anything else. Get in that mindset. If you're exercising, not doing it too late into the evening time because that raises your core body temperature, and you need a drop in your core body temperature to really initiate sleep. If you're drinking a lot of caffeine, 40% of people are fast metabolizers. They might get away with it a little bit, but more than half the people are slow metabolizers. So if you're drinking coffee at 9 o'clock in the morning, a quarter of that's still going to be in your blood when you're going to bed at 9 o'clock at night. Too much caffeine blocks adenosine. Adenosine is the initiator of sleep. When that pressure, too much adenosine builds up, you're going to sleep. So try to do everything you can from a lifestyle and sleep optimization. But then if you're still not sleeping well, or you have a cardiovascular issue, you have atrial fibrillation, high blood pressure, coronary disease, stroke, heart failure, well, again, that might be a chicken egg thing. They can worsen heart failure when you have apnea. If you have apnea, it can cause heart failure. So any patient who comes to me with a diagnosis of a cardiovascular disease, I'm always asking about their sleep quality because your body's repairing itself while it's sleep, but I'm making sure you don't have a sleep-related disorder. And again, sleep apnea is the number one sleep-related disorder. If you have narcolepsy, if you have restless legs, those are things that are going to require a board-certified sleep specialist to kind of really work up, and that's going to take an in-lab sleep study for sure. But many people can get away with doing an at-home sleep study to evaluate if or not they have obstructive sleep apnea. Question about supplements. Ashwagandha can help. That would be more of a something that would help with kind of calming down the adrenals. It's possible, but I can't prescribe or recommend particular supplements or dosages without having a kind of a patient relationship with people. But ashwagandha is mainly, it helps with adrenals. And some people, are very kind of amped up people, type A, high stress. And you have to be able to deal with your stress to be able to sleep well. If you're laying in bed ruminating about the day and pissed off about things, well, it's not your sleep that's the problem. It's you don't deal with your stress well. And so one thing I frequently recommend people consider, who aren't great meditators to begin with, which not everybody is the heart math device. I think I've shown this a few other times in other talks, but plugs into your phone, clips to your ear, and it measures your heart rate through the clip. And it's measuring your heart rate variability. The more variable your heart beats, the more relaxed you are because your parasympathetic and sympathetic tone are more balanced. The sympathetic tone is your fight or flight. The parasympathetic is your rest and relaxation. This helps train your relaxation stages. So, use this device, 5 minutes, a night for 4 or 6 weeks. Your sleep quality is probably going to improve because you're improving your stress response. Somebody's saying they wake up twice a year with something that seems like their mouth and throat are dry and I can't catch my breath for about 30 to 60 seconds. Is that sleep apnea or a laryngeal spasm? It's possible it's either or. That would be something that should be evaluated. They first should look in the back of your throat, see how big are your tonsils, adenoids. Is there an anatomical reason that would potentially be happening? Is it something that you have issues with your voice, you're hoarse, or you always feel that there's sinus drainage, something that would tend to cause the larynx to have more issues. But yeah, if your mouth is always dry and you're a mouth breather, that's something that I'd say take the stop bang quiz and see how many other risk factors you have. But that's something that might be worthwhile to get a home sleep study if you've not had one previously. All right, check and see if I got any other questions here. I got some questions on another thing. So, question, does daytime sleep make up for missed nighttime sleep? Partially. It's, in certain cultures, there is more a biphasic sleep response where, people will sleep six and a half hours, overnight, but then kind of catch up with like a siesta. But probably actually think about that the siesta is additive to the first night. It's not necessarily making up for the night that you missed. And unfortunately, sleep is not bankable. You can't sleep, 5 hours Monday through Friday and then Saturday, Sunday sleep 10 hours and make up for it. Your body doesn't work that way. So, you can only get the sleep that you require daily. If you miss it, that sleep pressure will build up. Your body's going to try to, claw it back. And, certain parts of the night, your body's going to try to dig back more deep sleep. And then later it's going to try to dig back more REM sleep, but you're never going to fully catch up. So, and I answered it last week about naps. Naps are not necessarily good or bad. It depends on, why you're napping and what you're using the nap for. Many people who have really poor sleep because of sleep apnea, they're taking frequent naps throughout the day because they're, completely fatigued, and they're having micro sleeps, which significantly increases the risk of having motor vehicle accidents. It's actually worse for you to be drowsy driving than it is to be drunk driving. And if you combine drunk driving and drowsy driving, it's like a 30x risk that you're going to have an accident. If you nap, and it's typically less than 90 minutes, so it's one sleep cycle or less, and you normally sleep well, the nap is not going to be a problem. But if you take the nap and then you also can't sleep for 2 hours when you want to go to sleep, then the napping is not beneficial. You want to keep the same wake-up time for the most part, no matter what, within 15, 20 minutes either way of what your normal wake-up time is, and then try to get back on track the following night if it wasn't a good night of sleep. Good question. This is one that I tell patients sometimes it is, but isn't necessarily one of the classic ones. This person's saying that they wake up every morning with a headache. Is this a symptom of sleep apnea? It's possible, but it also can be a side effect of having sinus issues. Depends where the pain is. If it's here or in the front part, more likely sinus, but it can also be hypertension. Your blood pressure starts increasing in the morning time as cortisol starts increasing between like 3 and 5 a.m. Cortisol rises to wake you up for the day. So having quote high cortisol. It's all relative, of course, but there's a surge in the morning time to get you ready for the day. It increases throughout the morning, and then in the afternoon and evening, it starts dipping down. If you have really high cortisol in the evening time, that's stimulating. It's basically telling you stay awake, go hunt, go forage for food. You got to stay awake and go do what you need to do. But that cortisol will have an effect on your blood pressure. So if you have excessively high blood pressures right upon awakening, that may be causing headaches too. So if you have the means to check your blood pressure at home, check your blood pressure and see what it is in the morning. But yes, talk to your doctor about that, because take the stop bang quiz. You have more risk factors. Again, maybe a good candidate to get a home sleep study. I'm seeing looks like some people might be in the fire service or firemen. Firemen, almost ubiquitously have sleep apnea. It's probably due to multiple factors, but if you want to perform at your best, you got to sleep at your best. And so if you're not feeling like you're getting your well-rested sleep on your off days, when you're not on call, highly consider getting checked out for sleep apnea. All right, well, we're coming up at the half hour, which is when I usually kind of wrap it up. If there's any other questions, I'll be happy to answer them. Next week, I will do a talk Monday, 6 p.m. Topic to be determined. It'll probably be something sleep related or something else interesting I learned this week. Some health optimization tip. But if there's a topic I haven't hit upon that isn't on one of my YouTube channels or the Instagram, TV, just shoot me a direct message and give me an idea of what you want me to talk about, and I'll try to put something together for you guys sometime. All right. So it doesn't look like any last minute questions. So again, thank you guys for watching tonight. I'm Dr. Michael Twyman. I work with Apollo Cardiology. If you're in St. Louis, I'm happy to set you up for one of these home sleep studies, and we'll get you checked out if need be. So I think I do have one more question and I'll answer it. How do you sleep longer? I wake up after 5 hours. I find it very hard to go back to sleep. I answered this a little bit more last week in Sleep 101. It's going to make sure that you have all your sleep hygiene dialed in, and then typically, if you're waking up 3 to 4 hours later, it's either your melatonin levels are low and then you're not staying asleep well enough. That's usually related to your light environment, or it can be something related to your hormones. So there's a Dutch lab is kind of my favorite lab company that does the cortisol melatonin testing, but also does your sex hormones. You can see if your sex hormones are out of balance, that might be driving some of the sleep as well. So, all right, guys, thanks again for joining tonight, and I'll see you guys next week. Have a great one.